So I'm super excited today. We have a fantastic panel of people who've been leaders in developing a lot of what the future of healthcare looks like in terms of payers and providers and how also the additional organizations who are taking on risk work together. So I'm going to avoid doing any introductions, but I'm going to ask a first question. And before you guys start, if you just want to say your name and your title and anything else you want to share. So in order to kind of kick this off, we really wanted to talk about setting the stage for what trends are happening that are really driving new innovation, new change in the relationship between payers and providers. Specifically, the increasing pressure on providers to take on more risk, the move in payers to start to move into care delivery, and how that's shifting the way that historically we've worked together, and sometimes what might be an adversarial relationship. So to kick it off, Q, I'm going to hand it to you to just kind of set the stage for what you're thinking.
Terrific. And Q Ree, Senior Vice President and Aetna Chief Medical Officer at CVS Health, primary care doc at my core. From my perspective, a big trend is what I would call value-based care is essential, but this evolution towards recognizing values-based care. And the fact that this pandemic has challenged the system and made us realize what are the values we want in our system. And we've discovered, unfortunately, whether it's infectious disease, chronic disease, mental illness, or health inequities, our system is not delivering on the values that represent what we and the people in this room and those watching virtually value. And so how are we going to make sure the system delivers on public health, primary care, prevention, equity, and mental health?
I think folks originally thought that value could only be done by folks who already had scale. And I think what Aledade and other competitors in that space are showing that independent primary care can be brought together as a unit to achieve scale and to achieve value. But data, and we'll get into this, is so much the oxygen that powers that scale. So that is certainly one trend where they're seeing, independent primary care can be a really important and frankly successful asset in achieving success and lowering costs and improving care. I think, again, a pandemic trend is that we're not just getting care in four walls anymore. And so what does that mean in terms of the technology, the data, and the workflow that we need to think about? And then the last I would say is realizing that if we are going to value things, the big picture of health, that can't just be about, am I taking my diabetes medicines, but it's also about stable housing and food security and understanding what is the data that powers information around that and then allows us to build systems around it.
Good morning, everyone. Deepesh Chandra. I'm the Chief Analytics Officer for Secours Mercy Health, and I'm also the President for Accrete Health Partner, which is one of our for-profit division to close the gap in terms of how do we make the best use of technology and ultimately create at-scale businesses that the providers can actually help accelerate some of these trends that we are talking about. So from my standpoint and my organization's standpoint and providers in general, there are two key trends that is happening, and this is happening at the backdrop of what's happening on the macroeconomics level for the providers. It's a perfect storm that everybody knows with labor disruption, cost compression, and all sort of challenges that is happening that is putting providers' business at risk. But in that, if you draw down, there are going to be two sets of trends emerging from it. One, is technology going to remain as a cost center for the providers, or is it truly going to become an enabler for the provider business? And I'm talking really at scale enablement, not innovations, not things happening on the sidelines, somebody doing it at the side of their desk, really in terms of, is it moving the needles on the balance sheet or not? That's number one. Number two, providers are generally at this point very, very primed to plug into the broader healthcare ecosystem through the data. They have invested significantly in the EMRs. They have some capability on their data warehousing. You can call it how robust that is, but they are ready. What they're looking for is the right set of economics model, whether it is coming in from the payer or life sciences company or such. And you will find many recent examples in the last couple of years that is truly a trend in the right direction, that the providers are ready to plug in, but it has to be incentivized appropriately. So those two trends, I think, are very relevant and are going to accelerate, rest of everything that we are talking about.
Simona Siddiqui. Up until recently, I led clinical strategy and quality for the insurance segment within Humana, and have recently taken on leading clinical operations for our home segment within the care delivery business at Humana, which is now called CenterWell. So I think, again, this is maybe a bias that I have from a trend perspective. I think there's more and more care moving into the home and out of the acute settings. I think all of us want to age in home and community-based settings to the extent possible. It's something I feel really passionate about. It's part of our mission at Humana. And I think with that trend of more care moving outside of traditional settings, you also have to think about the different ways in which you're engaging patients, in which you're collecting information. I think already we know that the vast majority of information that's relevant to somebody's health doesn't get collected at an encounter. It is happening all around them. And so I think there's an opportunity for us to think about how we deliver new kinds of programs for patients in their homes, how we think about engaging the workforce in a different way, and how the data collection as a result is very, very different. And what we do with that information and the expectation for how quickly we should be able to get that information to act on it. And I think the other thing I would say is that obviously coming out of the last few years, the consumer expectation has changed dramatically around what they think should be accessible to them within their homes, the way in which they do expect to receive care. So I think there is an onus on all of us to think about how we design care that is much more seamless, easily accessible, and that data is really the piece that powers all of that to come to life. But I do think that both of those, sort of the home and then the consumer expectations, for me are two enormous trends.
Well, first, I don't want to say the claims data is still really important and powers so much of what we are able to do at Aledade and provide to docs. And they will say, wow, I have never seen these insights before. And to defend CMS for a little bit, my former place where I worked for quite some time, they are still the most timely in providing that data. So we work with a lot of payers across the board, and claims data still, it's lagged in and of itself by the nature of it being claims, but then it gets even more lagged through a process, and CMS is actually our most timely provider, though I want to shout out to Humana. They're also an incredibly timely partner for us, and that is why you see Aledade and Humana have a strong partnership, because in order to do the work with independent docs, the data is the oxygen that powers it. So we are able to give them a lot of insights, but on the other side, we need more than just claims. So we are able to combine data feeds like an ADT feed from hospitals, but again, not everyone is forthcoming with that kind of data, so it makes it hard for our practices to follow up with patients when they've been in the emergency room or discharged from the hospital. Those are really important feeds that we need. And then obviously, we were both sharing before, as we get into this more expansive view of health and where we're getting our care, we really need to pull in data sources that are not just specifically what is your med list, what is your problem list, but really what is the picture of your health. That could be informed by everything from what you're buying on Amazon to the other sources of data you can even get from the government and other spaces, like are you eligible for SNAP or WIC or other kinds of programs.
When we think about improving care delivery, you want to make sure that you're addressing some of the obvious inefficiencies in the system to the extent possible. And some of those are just around, how might you support the nurses that are going in the home, or and what is the information that we need really quickly to be able to then do a different set of actions. And sometimes it really is about legacy systems, as we talk about all the time, that are in place that are not connecting the right. So the administrative systems are not talking to the clinical systems, are not talking to the on-demand response sort of pieces. And so how do you actually knit all of that together, I think is a challenge. Addressable, but these things take time and investment, and we live on quarterly cycles, and so you do have to say, how can I show some short-term return here for what I'm investing in while I build for the long-term capabilities that I need. I think the other dynamic that has to change is, frankly, when we partner with other entities across the healthcare ecosystem. And so, we partner with a fair number of companies and growth stage startups. And I think the expectation for information sharing has to change. It can't be that we'll run a pilot and 6 months later we'll talk and look at the data. The expectation has to be, how are we doing week by week? Are we meeting our consumer expectations? It's not just about seeing whether you're impacting cost at the end of 6 months. It's also about understanding the consumer experience week by week and understanding what you need to do differently. So I think there's a little bit of that paradigm shift that has to happen. Again, these are not hard things to do, but the expectation setting has to be very, very different.
Let me start by saying that we heard earlier today people talking about access to the data. Providers are disproportionately largest producer of the data in the healthcare ecosystem. And we all feel that providers have this locked up and doesn't want to share. If you look few layers underneath, the challenge is really providers are not incentivized in terms of be able to open that data set that is generally locked into proprietary structures of our EMR system. And I won't name the vendors, but they are difficult to pull data out from. And it's not just EMR vendors, it's every other clinical system. Talk about PACS systems, talk about labor. We are looking at labor shortages quite closely, and pulling data from some of these nursing systems are also equally challenging. So for a provider to invest into cutting the data out from these systems and making it available for the rest of the ecosystem, it's a lift. It's a lift that is really important for folks to understand that how providers are going to achieve that and what level of investment do you have to do. So just a mere expectation that becomes a cost of doing business for providers when you are running into an economic climate where all margins are depleted, we are simply adding more and more cost to the business. So from all the technology leaders working in provider space, their budgets are shrinking. It's a 10% year-on-year decline that we are going to see, if not more. So thinking about how you are constructing a business model that allows them to invest into those foundational technologies to pull the data out so that we can open it to the rest of the ecosystem is really, really critical. And the government also has a very important role to play in this. I dated back 20 years back with HITECH Act. There needs to be a HITECH Act for opening the data from the provider ecosystem. And if the government can keep passing regulations in terms of interoperability and standard and forcing providers to pay for it, it's very easy for providers to just remain non-compliant and pay the fine and carry on the business as is. It's not good enough. And so both from a regulatory perspective, but also rest of the healthcare ecosystem, you have to think about how to link the provider. And the closest one are the payers. When we work with them on set of topics, there is a baked-in contractual arrangement that we have that we can create incentive structure to exchange that data. This just doesn't exist with life sciences companies, med devices companies, government agencies just yet.
I will say the paradigm I think is, as a primary care doc here in DC at the corner of 14th and Irving in a federally qualified health center, that dynamic between a patient, provider, and the role of the payer. And the important role that we have as a payer, but at CVS Health we're also a provider, to create the right relationships that facilitate trust. Because in my mind, data is all about trust. And so we have current approaches where we have to treasure what we measure, and so that's important to leverage. But I think the big question I keep asking within CVS Health Aetna is, those are important measures that we have to treasure, but let's measure what we treasure. And there might be things we don't currently sufficiently measure, and this is where I think you have to use the data you have, but you have to ask, what's the data you need? And this is where the work that I did on the 3D Commission, which I love the paradigm of determinants, data, and decisions. So the data's in the middle. It's core to facilitate real decisions in real time. A challenge with claims data is that often it's not in real time. And then you need often more determinants than you often get in claims data. So, how do you have that trust in that triad, the payer, provider, and patient, to facilitate the right data on the right determinants, to facilitate the right decisions? And so, we as a system have a long way to improve, but I think that idea of creating that trust across those three stakeholders is core to what we're committed to. So trust is so important. Like I reflect on the role that we have as a payer to be the partner of choice for providers, to facilitate that dynamic in that exam room between a patient and a provider. What we have to recognize that, and many studies have shown this, there's a large variability of care. There's a large variability of the application of evidence-based medicine. So the role that we have as a payer with the data we have access to assure that the right care is delivered at the right time, is an important factor in that role we have for those members and those patients that are being served. So as I reflect on utilization management, prior authorization, the inevitable transformation will be leveraging data and technology to facilitate a quicker, simpler, more accessible. I mean, if I use my credit card, I'm not waiting for 2 weeks or months to see if it's going to be covered. We need, as a system, to reflect on how we can learn from other industries and facilitate that trust and the right decision at the right time. That goes back to those 3 Ds I was referencing. Often our decisions are delayed because we don't have the data. And often, we need more data. And so automation, gold carding, there's lots of opportunities for the system to make sure that that's a more better experience for the member and the provider. And so we're committed to addressing that with partners like the ones here.
When we as an organization agree to take on accountability for total cost of care and quality, you don't need the ticky-tacky, check the box things, and folks take off the handcuffs. And our payer partners have done that. Not across the board, though. And this, I think, goes to Q's point around trust. I think as companies like Aledade can show results, right, to say, look, we're taking accountability for total cost of care and quality, and we are showing that we are doing the improvement in health. You don't have to be in the weeds with our providers, and they do take off those handcuffs, and it's great. That's when it's working well. But that's not across the board, and that trust is not there across the board. And I would say it sort of correlates. The folks who are better at sharing data with us are also more willing to say, we trust you, Aledade, and your practices to deliver. And so we're taking off the handcuffs of utilization management and prior authorization. The ones that are less good at sharing data with us, interestingly, keep on those controls. So it's an interesting dynamic there. I think we're in the middle of it. And I think it's also, talking about improvements in systems, we see the legacy data systems, unfortunately, rearing their head and sort of driving business decisions as opposed to seeing into the future to be like, that's where we want to go. And so the folks who aren't able to unlock their data in a way to help us move towards value keep on some of those tighter controls like utilization management.
Utilization management, it's a bad word in some ways, right? To me, it's really done effectively. It's about how do you deploy evidence-based care. I don't think any of us thinks that everything that is available should be deployed for every single condition. So I think we can agree on that premise. Cohere is a company that we launched about 3 years ago, which was really designed to address this pain point. And it has worked with specialty societies to say, what are the right evidence-based care paths for these particular conditions? How do we automate those? And for providers that are essentially are showing high rates of compliance, they get approved to begin with. So we decrease the friction there for both our provider partners as well as, of course, for the patients. So I do think that there are these solutions. I think you have to partner, and I think it has to be really embedded in what is the clinical evidence. How do you embed that into technology workflows? And then how do we work on modifying that, getting feedback from our users, from our provider base, and then really scaling that. So we've done that with MSK. We have done that. We're doing that with a couple of other condition areas, but that really is the intent. And I think we need to slowly shift that mindset to prior auth or being sort of a utilization tool, but it's really more about deploying evidence-based care.
Really is the right care at right time and alignment with evidence-based medicine. I do get worried when we use terms like abrasion, friction, handcuffs. It creates, it enables some of the mistrust that we have to address. And we've got an opportunity to highlight and reframe some of the words we've used in the past and think about a better future.
I think it has to be more than different words, though. It has to be different processes so that if we all want to live up to the word value, right, and we're talking about what values are, right, if we want to value health, we need to measure health outcomes in a real way, and then have that trust based in evidence that our providers are going to live up to that. And there's payer and provider have to live up to both sides of the equation there, right? With payers being able to share data to inform timely, good, evidence-based care. And so I do see that happening, but I think it's more than just word changes. I think we have to get underneath
I'm not a big believer. You shouldn't say words without substance, right? That's character. So I agree completely.
I think we all aspire for data to be open. I do believe that we are trending in the right direction where the data will become far more accessible. We are headed in that direction. I think from a future perspective, what we would love to see is data and broader technology kind of truly becomes an enabler for the behemoths in the industry, especially payers and providers. They're still being seen as cost centers, not a true enabler to the business and such. And so that would be the real motivation behind this. That something is pertinent in finance and retail today. And hopefully we can continue this trend where technology is really seen as an enabler, not as a cost center.
We look at data at the end of the year or once a project is done. I think there's just a lot of alignment needed up front around the set of outcomes that we want to drive towards. And expectation setting, regardless of the relationship, what are the set of outcomes that we're going to drive towards? And then how are we sharing information to achieve those? And having that be a part of every contract, not just from a regulatory perspective, but really every single arrangement needs to be embedded in outcomes, taking risk for outcomes, and having a shared understanding of the data transfer that has to happen to enable that.